Alright, so guys, we are looking at pelvic organ prolapse. Alright, of course, even if the first time you are coming across the word prolapse, it sounds like something is falling, you know. So, it's unfortunate that some women, the muscles in their pelvic floor can get weak, you know. So organs on the top, they're kind of like falling. All right, organs on the top are kind of like falling. All right, so it's just a condition that occurs when the muscles and tissues of the pelvic floor they weaken, allowing one or more of the pelvic organs to drop from their normal positions. This will now bulge into or out of the vaginal canal. Do you understand? See this uterus that is up here. For this one, see how the uterus is falling into the vagina. You understand? So what is the pelvic organ prolapse? You know, so it usually happens when the supportive structures in the pelvis, like the ligaments, the muscles, you know, all the beautiful things there, you understand, when they become too weak to be able to hold the pelvic organs in place. So examples of these pelvic organs include what? Bladder, you know, uterus, the vagina, the rectum, the small intestine, the urethra. Okay, so those are all, you know, the organs that could actually get a problem. All right, so causes and risk factors is this: vaginal birth, especially if you have had so many vaginal births or traumatic deliveries. Menopause. So due to decreased estrogen, some structures in the body start becoming weak, you know. Aging, the woman is aging. Obesity, chronic cough. When you cough, you know that your stomach will be contracting. It is chronic over a long time. All right, the pressure that comes with that, heavy lifting, previous pelvic surgeries, that's hysterectomy, genetic predisposition. So symptoms actually vary depending on the organ involved and severity, but a sensation of pressure or fullness in the pelvis is usually common. A visible or palpable bulge in the vagina. All right, urinary issues, bowel problems, lower back pains, pain or discomfort during sex, difficulties inserting tampons. So in some cases, symptoms worsen throughout the day or after prolonged standing. So types of the prolapse is this: we have the cystocele. All of them are actually here, you know. Cystocele, rectocele, uterine prolapse, vaginal vault. Okay, please, you can pause your video to observe what is on the screen. I think, okay, this is a better picture. Cystocele, rectocele, enterocele, uterine prolapse. So that I'm explaining here, you guys will get to know. Cystocele, the bladder is dropping. Rectocele, the rectum is dropping. All right, uterine prolapse, you know, the uterus all the way from there is kind of like dropping in, you know. Vaginal vault prolapse, this one top of the vagina sags, you know. Uterocele, the urethra drops, you know. So treatment options can be pelvic floor therapy. They'll tell you to start doing Kegel exercises. Vaginal pessaries, lifestyle changes like weight loss, avoid lifting heavy weights. All right, so surgical treatment is what? Vaginal abdominal repair procedures, minimal invasive options like laparoscopy. All right, there are newer devices like the Mendit system, which uses sutures to resuspend the prolapsed organs. So for hormonal therapies, All right, estrogen. You know that most women with these issues, they have hit menopause, so they are lacking estrogen. So you replace estrogen for the women. Okay, so that's it for the pelvic organ prolapse.